Feeding or eating disorder.
Introduction. A chronic disturbance of feeding or eating related behavior that results in changed food consumption or absorption and significantly compromises physical health or psychosocial functioning is referred to a feeding and eating disorder. PICA, rumination disorder, avoidant restrictive food intake disorder, anorexia nervosa, bulimia nervosa, and binge eating disorder all have diagnostic criteria.
PICA disorder. PICA disorder is one of the eating and feeding disorder. It is a compulsive eating disorder in which people compulsively eat one or more non-food items such as ice, clay, paper, ash, or dirt. Bhagirathi is a subtype of PICA. They eat non-food substance or non-nutritive items on a persistent basis over a period of at least 1 month. Eating items like dirt, clay, and flaking paint are the most common items eaten, and the less common items include glue, hair, cigarette ashes, spring, wool, soil, and feces. People with PICA aren't compelled to eat ice because of a physical disorder like anemia. Instead, it's a mental disorder. PICA often occurs alongside other psychiatric conditions and intellectual disabilities. It can also develop during pregnancy. The symptoms of PICA disorder that are related to non-food items are stomach upset, stomach pain, blood in the stool, bowel problems. And what are the causes of PICA disorder? PICA is a very dangerous condition. It can lead to a variety of complications. Many of them lead to medical emergencies. While ice won't do internal damage, other non-food items can. If someone has Bhagirathi, they might be compelled to eat other substances too. So depending on what they eat, PICA can lead to problems. That is intestinal obstruction, perforated torn intestine, poisoning, infection, and choking.
Now, let us look into rumination disorder and avoidant restrictive food intake disorder. Rumination disorder. Rumination syndrome is a condition in which people repeatedly and unintentionally spit up undigested or partially digested food from the stomach, rechew it, and then entirely re-swallow it or spit it out. Because the food hasn't yet been digested, it reportedly tastes normal and isn't acidic, as vomit is. Rumination typically happens at every meal soon after eating. It's not clear how many people have this disorder. Treatment may include behavioral therapy or medications. Behavioral therapy that involves teaching people to breathe from the diaphragm is the usual treatment of the choice. Symptoms of rumination disorder. Number 1. Effortless regurgitation, typically within 10 minutes of eating, abdominal pain or pressure relieved by regurgitation, a feeling of fullness, bad breath, nausea, unintentional weight loss. DSM-5 criteria for rumination disorder. Repeated regurgitation of food for 1 month or longer. The person may spit out, rechew, or re-swallow the regurgitated food. The regurgitation is not being caused by medical conditions such as gastrointestinal disease. The repeated regurgitation is not due to anorexia nervosa, bulimia nervosa, binge eating disorder, or avoidant restrictive food intake disorder. If another mental disorder is present, such as an intellectual or developmental disorder, the repeated regurgitation is severe enough to require independent clinical attention. Prevention. Experts aren't sure why rumination syndrome starts in the first place, so it's unclear what can be done to prevent it. Treatment for rumination disorder. Treatment depends on the exclusion of other disorders as well as on age and cognitive ability. Number 1. Behavior therapy. Habit reversal behavior therapy is used to treat people without developmental disabilities who have rumination syndrome. People learn to recognize when rumination occurs and to breathe in and out using the abdominal muscles during those times. Diaphragmatic breathing prevents abdominal contractions and regurgitation. Biofeedback is part of behavioral therapy for rumination syndrome. During biofeedback, imaging can help you or your child learn diaphragmatic breathing skills to counteract regurgitation. For infants, treatment usually focuses on working with parents or caregivers to change the infant's environment and behavior. The second treatment method is medication. Now, let us look into avoidant restrictive food intake disorder. Avoidant restrictive food intake disorder. Avoidant restrictive food intake disorder is an eating disorder. Children with ARFID are extremely picky eaters and have little interest in eating food. They eat a limited variety of preferred foods, which can lead to poor growth and poor nutrition. ARFID usually starts at younger age than other eating disorders. Unlike anorexia and bulimia, which are more common in girls, boys are more likely to have ARFID. The symptoms of ARFID. Picky eating and a general lack of interest in eating are the main features of ARFID. People with ARFID may not feel hungry or are turned off by the smell, taste, texture, or color of the food. Some kids with ARFID are afraid of pain, choking, or vomiting when they eat. Many kids with ARFID are underweight, but others are normal weight or overweight, especially if they eat only junk food. Kids with ARFID are more likely to have anxiety or obsessive compulsive disorder, autism spectrum disorder or attention deficit disorder, problems at home and school because of their eating habits. Criteria for ARFID. If a doctor thinks a child might have ARFID, they'll do an exam and ask about the child's medical history, eating and exercise habits, and emotional issues. Doctors and mental health professionals will look for significant weight loss, serious nutritional deficiencies, poor appetite, lack of interest in food, or food avoidance. Symptoms should not be because of a lack of access to food, another eating disorder, or other medical problems. Doctors may order blood tests, urine tests, or an electrocardiogram to check for problems. Treatment plan for ARFID. ARFID is best treated by a team that includes a doctor, dietitian, and therapist who specialized in eating disorders. Treatment may include nutrition counseling, medical care, and feeding therapy. If choking is a concern, a speech-language pathologist can do a swallowing and feeding evaluation. The main goals of treatment are to achieve and maintain a healthy weight and healthy eating patterns, increase the variety of foods eaten, learn ways to eat without fear of pain or choking.
Anorexia nervosa. Anorexia nervosa is a serious and potentially life-threatening but treatable eating disorder. It's characterized by extreme food restrictions and an intense fear of gaining weight. Treatment usually involves several strategies, including psychological therapy, nutritional counseling, and/or hospitalization. What is anorexia nervosa? Anorexia nervosa is an eating disorder. People with anorexia limit the number of calories and the types of food they eat. Eventually, they lose weight or cannot maintain an appropriate body weight based on their height, age, stature, and physical health. They may exercise compulsively and/or purge the food they eat through intentional vomiting and/or misuse of laxatives. What does anorexia affect? Anorexia can occur in people of any age, sex, gender, race, gender, ethnicity, sexual orientation, and economic status, and individuals of all body weights, shapes, and sizes. Anorexia most commonly affects adolescents and young adult women, although it also occurs in men and in increasing in numbers in children and older adults. How common is anorexia? Eating disorders affects at least 9% of the worldwide population, and anorexia affects approximately 1% to 2% of the population. It affects 0.3% of adolescents. Diagnostic markers. The following laboratory abnormalities may be observed in anorexia nervosa. Their presence may be shown to increase diagnostic confidence, such as hematology, serum chemistry, endocrine, and electrocardiography, bone mass, electroencephalography, resting energy expenditure, physical signs and symptoms, and what tests are used to diagnose or assess anorexia may include complete blood count, electrocardiogram, that is EKG, urinalysis, bone density test, kidney function test, liver function test and thyroid function test, vitamin D levels and pregnancy test, etc.
So let us discuss about bulimia nervosa and binge eating. Bulimia nervosa. Bulimia nervosa, commonly called bulimia. It is a serious, potentially life-threatening eating disorder. People with bulimia may secretly binge eating large amount of food with a loss of control over the eating and then purge, trying to get rid of the extra calories in an unhealthy way. To get rid of calories and prevent weight gain, people with bulimia may use different methods. For example, you may regularly self-induce vomiting or misuse laxatives, weight loss supplements, diuretics, and enemas after binging. Or you may use other ways to rid yourself of calories and prevent weight gain, such as fasting, strict dieting, or excessive exercise. Risk factors of bulimia nervosa. Girls and women are more likely to have bulimia than boys and men are. Bulimia often begins in the late teens or early adulthood. There are some of the factors which increase the risk of bulimia may include biological issues, psychological and emotional issues, and dieting. Biology. People with first-degree relatives like siblings, parents, or children with an eating disorder may be more likely to develop an eating disorder, suggesting a possible genetic link. Being overweight as a child or teen may increase the risk. Psychological and emotional issues. Psychological and emotional problems such as depression, anxiety disorders, or substance use disorders are closely linked with eating disorders. People with bulimia may feel negatively about themselves. In some cases, traumatic events and environmental stress may be contributing factors. Diet. People who diet are at higher risk of developing eating disorders. Many people with bulimia severely restrict calories between binge episodes, which may trigger an urge to again binge eat and then purge. Other triggers for binging can include stress, poor body self-image, food, and boredom. Let's look into binge eating disorder. It is a serious eating disorder in which you frequently consume unusually large amount of food and feel unable to stop eating. Almost everyone overeats on occasion, such as having seconds or thirds of a holiday meal. But some people, excessive overeating that feels out of control and becomes a regular occurrence crosses the line to binge eating disorder. Here are the psychiatric disorders that are linked with binge eating disorder. They are depression, bipolar disorder, anxiety, and substance use disorders.
Or the specified feeding or eating disorder. Although a person with OSFED does not fit the criteria of any eating disorder, many of the symptoms of other eating disorder are present. OSFED is just as dangerous as other eating disorders, and it's linked to a variety of physical and behavioral issues. OSFED is a dangerous, complex, and potentially fatal mental condition that affects adults, teenagers, and children. OSFED medical problems as well as eating disorder, beliefs, and behavior are as serious as those associated with other eating disorders. Disturbed eating habits or distorted body image, overvaluation of shape and weight, or an excessive fear of gaining weight are all prevalent symptoms of OSFED. OSFED is the most frequent eating disorder in adolescents and adults, and it affects both men and women.
Let us look into unspecified feeding or eating disorder. When an individual's symptoms do not match those of another illness, or when there is insufficient information to make a more specific diagnosis, UFED is diagnosed. This unspecified feeding or eating disorder label may change as additional information becomes available or as symptoms evolve. It is not enough to have disordered ideas and behaviors about food and body image to be diagnosed with an eating disorder. These thoughts and behaviors must be serious enough to cause the individual significant suffering. Disordered eating practices that generate severe distress or impairment are symptoms of UFED. The severity of a person's disordered behavior varies tremendously. Restriction, binging, or purging are all common habits. Binge eating is when a person consumes a great amount of food in secret until they are uncomfortably full. Binge eating is generally out of control, leaving the person feel guilty and ashamed. Conclusion. To summarize, I believe that feeding or eating disorders are one of the unpleasant realities of modern world. It is not a lethal disease like cancer or AIDS, but it has a negative impact on the human psyche. An unhealthy mind, more often than not, has the capacity to make the body unhealthy as well. The mental health of a person is just as important as their physical health.
Thank you for listening. Have a great day.